what Joe does and what Aged does and how we help clients together. So I'm sure that towards the end of the presentation, I'm going to be doing a little piece on special needs trust and how they can get extra benefits for your clients that are already on Medicare. I just ask you to put your questions into the chat, please. And we'll be pausing periodically to take questions. We have a lot of material to go through today. And Julie Streer, who has been helping to coordinate this program for us, I'd like to thank Julie, number one. And she will be sending an email out after the program with a certificate of attendance, and will be helping with the CEs for the guardians. So thank you again for attending today. And I'd like to introduce our speaker, Joe Santiago. Joe is an independent insurance agent specializing in Medicare. So Joe, welcome.
Thank you for the introduction, Sharon. It's been a pleasure working with you for 10 years. We've been able to help a lot of people during that time.
Yes.
I am an independent insurance agent. I've been an agent since 1993. I'm independent, so I work with most all of the companies that offer Medicare plans. The last 20 years, I've been self-employed independent. Prior 7 years, I worked for a couple of companies as captive agent. But I became independent because I wanted to be able to advise people to basically assess a situation and try to match people up with the right company and the right product, regardless of what they may be. Without having, I want to put myself in a position where I would not think of steering a person. I can just advise a person and show them what's available, and also educate, explain the Medicare program and how it works. What we're going to be talking about is the Medicare program, what it covers, what it costs, when you should sign up, if you should sign up, and when to. And after that, we're going to be covering the different options, the different plans that work with Medicare. And whether that be, we'll talk about Medicare Supplement, Medicare Advantage, and prescription drug plans. So, and again, if you have any questions, please use the chat feature and we'll try to address them. But basically, let's start the presentation. And we're going to talk about first what Medicare is, the Medicare program. Medicare, in its basic form, is health insurance for people that are either 65 or older, have certain disabilities, and have qualified for Social Security for at least 24 months, or have certain disabilities. So you either get Medicare one of two ways. You're either 65 or you've been on Social Security disability for 24 months. Or if you contracted end-stage renal disease or ALS, you get it immediately. That is kind of a little cut off there, a picture of the Medicare card. The new Medicare numbers, okay. The new Medicare numbers are actually 11 characters. It used to be a Social Security number, but thankfully they did away with that because of identity theft. Now it's 11 characters, a combination of letters and numbers, and it's unique. Everybody has their own unique number. Okay, so when do you enroll in Medicare? Medicare enrollment begins basically 3 months before, the month of, and 3 months after your 65th birth month, or when you've qualified for Social Security disability for 24 months. It starts automatically. During this time, you make the decision whether you're going to take Medicare A and B. If you are getting a Social Security check, you'll actually be automatically enrolled. So if you don't want your Medicare, and I'll explain why you may not want to, you have to inform Medicare Social Security that you don't want it. If you're not getting a Social Security check, then you actually have to be proactive and apply for Medicare A and B. So should you get Medicare or should you not? Many people are still obviously working when they're 65 and over. So the question becomes, I have employer insurance. Should I take my Medicare at this time? The rule of thumb is that if you are still working and you have qualified group insurance and it's more than 20, it's a large employer, more than 20 employees, you should take Medicare A only. you should delay typically your B while you are still working. The reason being is that there's a cost to Medicare B, and it does not coordinate very well with large group insurance. So it could be a waste of money. You want to check with your benefits administrator to make sure, but in most cases, you want to delay the B, and you can delay the B indefinitely while you have qualified group insurance. If you're working for a small employer, less than 20 employees, you should enroll in Medicare A and B. Okay, if you don't do it, then you could be penalized later on if you don't. In some situations, some people are working for a large employer and they're contributing to an HSA. If that's the case, you don't want to enroll in A or B, okay? Because if you have large group insurance, you don't need the B. And if you want to put money to an HSA, you can't enroll in Medicare A and still contribute to an HSA. Now, when you're retiring, if you've delayed your Medicare, when you're 65 and over and you're still working, you can actually apply for Medicare B at any time. But when you retire, the clock starts ticking and you have to take Medicare B within 8 months of your retirement date. Okay, most people will take it right away because they'll need the Medicare A and B to get secondary insurance. But that's the rule of thumb. In every case, you want to check with your benefits administrator, whoever handles your group insurance, to find out what they recommend that you do. But the rule of thumb is large group, you delay the B, small group, you take the B. Okay. Talk about enroll.
Hold on, Joe. Quick
Yes.
question.
Yeah.
Are you saying that if you take Social Security early at 62, you can get Medicare?
No, Medicare is only available for someone that has either reached age 65 or they've qualified for Social Security disability. And they not have said specifically disability, my mistake.
Right.
You're on Social Security disability for 24 months, then you can qualify for Medicare A and B. Social Security at age 62, you can apply for it, but you cannot get your Medicare benefits unless you're also disabled for the 24-month period.
Right.
Good question. Okay, how do you apply for Medicare? Well, if you're getting a Social Security check, your Medicare card will be sent to you automatically. If you are not, then you have to be proactive and apply for Medicare at the Social Security website. You're turning 65, you go to ssa.gov and you can apply for Medicare right there. If you're going to apply for both Social Security and Medicare at the same time, then when you're doing the Social Security app, you'll also do the Medicare app. Okay. So now, if you decide not to take Medicare B when you turn 65 and you delay it, and you want to pick it up in the future, there's a different avenue that you have to go through. You have to submit an application for the Part B to Social Security. And you'll also have to submit an employer form that shows that you've been insured under a qualified health insurance since you turned 65. And the purpose of that is so that Medicare knows you've had qualified coverage, they're not going to assess a late enrollment penalty. A lot of people think that if they delay Medicare B, even if they're working, they're still going to be penalized. Not true. If you're working, or if you are insured through a spouse that is working and you have qualified coverage, you can delay the B, till age 80 if you want to without a penalty. Some people actually work in that one. Okay, talk about the cost of Medicare. Medicare, for most people, Part A is free. Part B is the amount that you have to pay for. For most people, it's $148.50 per month. That's the rate in 2021. It goes up a little bit each year. If you happen to be getting a Social Security check, that premium will be deducted right from your check. If not, then you will be billed by Medicare for that premium. If you are what we call a high income earner, you could have to pay more for Medicare B, more than $148.50. This is a little chart here which shows that high income earners have to pay an additional amount for Medicare B beyond the $148.50, and you can see it could be very expensive. The way they figured this out is they look at your tax return for the prior 2 years to determine what your income was. What they go by is your adjusted gross income or modified adjusted gross income which basically is your AGI, and they just add tax exempt interest to that. Now, most people are not going to be hit with this, but we're finding that because they haven't raised these amounts very much in the last 20 years, that more people are falling into this. If a person is subject to this, they'll be notified. They can request an exception to paying that higher amount if they can show that their income has dropped substantially over the last couple of years because they retired. So a lot of times this penalty can be waived, but you don't worry about it unless you actually receive a notice that you have to pay more. And like I said, more and more people are getting this, especially people that are selling property, a business, people that take money from a 401k, all that's countable income. So before a person does that, they want to be aware that this could affect their cost of their Part B. They should get with their financial advisor on that. Okay, so a little bit about how Medicare, the cost, when to get it, how to get it, and the cost of it. We're going to talk now about the parts of Medicare, what Medicare actually covers. Medicare on the card says Part A hospital and Part B medical. Think of Part A as being inpatient care, meaning that you've actually been admitted to the hospital. Not that you just went to the ER and went home, or you went there for testing and went home. It's actual admittance to the hospital. If you're in observation for a day or two and not admitted, it's not going to be a Part A charge. You have to be admitted to a hospital, a skilled nursing facility, or hospice, or qualify for home confinement for it to be a Part A charge. Part B deals with everything that is outpatient. Doctor visits, urgent care, medical equipment, labs, testing, x-rays, ambulance, anything that doesn't involve a confinement actually comes under Medicare B. Okay, so we have Part A, Part B that appears on the Medicare card. There's also two more parts, Part C, which is Medicare Advantage plans, and Part D, which is prescription drugs. This does not appear on your Medicare card because these are benefits that are received through an insurance company. And we're going to talk a little bit more about Medicare Advantage and the prescription drug plans coming up. But this is basically what Medicare covers. Okay. I see you have some questions in the chat. Did you want to, we'll take a pause here and see if we can answer some of the questions in chat.
The biggest question was whether or not the slides would be available. So I was letting people know that we are going to send out a summary, which is basically like the slides without the pictures, but we'll send out a nice summary when all this is done, so that everybody can have some extra little notes and stuff.
Mm-hmm. We've condensed it onto 3 sheets, but by all means, if anybody has a question in the future, if you don't find it on the cheat sheet, you're always welcome to call or email or text me. That information will be available. I'm happy to respond to questions at any time. Okay. Any others, Julie, you want to, we're good?
Nope, that was it.
Okay, very good. All right, we're going to move on to the next section now, which is Medicare plans and how do you receive Medicare benefits. There are 2 ways that Medicare benefits can be received. One way is called Original Medicare. The other way is called Medicare Advantage. And most of what we talk about in the next 15-20 minutes is going to be the difference between the 2 and the choices between the 2. So we're going to actually come back. This is an important page. We're going to come back to this slide periodically because it's really much lays out the choice that a person has to make. Now, one of the ways you can get Medicare is what we call Original Medicare. What is Original Medicare? Original Medicare is you have an active red, white, and blue Medicare card. You can take that card and you can go to any doctor, any hospital, anywhere in the country. The federal government is going to pay a portion of that bill. You who pay secondary are going to pick up what Medicare doesn't pay for. Medicare pays primary, you pay secondary. What is secondary? Secondary is deductibles, copays, and coinsurance. This here is a little chart of the Medicare copays and coinsurances. Now, Most people who have health insurance are familiar with these terms, deductible, copay, co-insurance. I have that on my existing health insurance. But there's a huge difference when it comes to original Medicare. With group insurance or any type of individual insurance, you have an amount that limits your out-of-pocket. So if you would have, God forbid, $2 million bill for cancer treatment, you know that you don't have to pay more than $3,000 or $4,000 or $5,000 or whatever the insurance cap is. The insurance company will pay 100% at some point. Not so with original Medicare. With original Medicare, going back to our example of $2 million worth of cancer treatment, you could be responsible for 20% of that, which is a large number. If, God forbid, someone receives, it goes on kidney dialysis. Last I had looked, that runs $14,000 a month. And you'd have to pay 20% of that. We're talking very big numbers. So the choice that nobody makes is just to go with original Medicare only. There are some people that do it. It's very, very rare because, as you can see, there's unlimited liability for your health care. So what do people do? Well, going back to our chart, people will do one of two things. They will either keep original Medicare and get what's called a Medicare supplement, or they will disenroll from original Medicare and go on Medicare Advantage. And we're going to talk about the differences between the two. First thing I want to mention is that you can never be on original Medicare and Medicare Advantage at the same time. It's one or the other. So if you're on original Medicare, the insurance you'd have is a Medicare supplement. Medicare supplement only works with original Medicare. If you're on Medicare Advantage, a Medicare supplement will not work for you. It's either you're on original Medicare or Medicare Advantage. You can never be on both at the same time. You do have opportunities to go back and forth during the enrollment periods, which we'll talk about in a little bit. But first, I want to talk about what is Medicare supplement insurance. Medicare
Quick
supplement
question.
insurance. Yeah.
Is there the third option is traditional Medicare and Medicaid, correct? That was the question in the chat.
Well, I guess if you did not qualify for Medicare, that could be an option. Most everybody qualifies for Medicare, and to get Medicaid, you have to meet an income qualification. Your income and your savings has to be very low in order to get Medicare. So, in order to get Medicaid, and in most all cases, you're going to be much better off taking your Medicare. We're going to come talk about this in a little bit, but if you qualify for Medicaid, it'll actually eliminate your Part B premium, and it's the best route to go. So we'll talk about how Medicaid kind of can complement Medicare, but not be an alternative to Medicare.
Right. And I think the question may have been more Medicaid as a supplement to your Medicare. And yes, there are programs that act like that.
They said like a third. They kind of made it sound like a third choice.
Okay.
Yeah.
So Medicaid can act as a supplement to your Medicare and cover that 20% that Medicare does not cover. And there's two ways to do that, and we'll talk about that a little bit later in the program.
And Medicaid also comes into play with Medicare Advantage too. We'll
Right.
talk more about Medicaid in a little bit. So Medicare supplement plans. These are insurance plans sold by private insurance companies. They are for a person that gets a Medicare supplement, they will be charged the monthly premium for the insurance. This is in addition to the $148.50 that you have to pay for Medicare B. The purpose of Medicare supplement plans is to pick up the deductibles, the copays, and the co-insurances associated with original Medicare. That's their sole purpose. They're to protect people who have original Medicare from having catastrophic medical expenses with the 20%. So Medicare supplement, it works only with original Medicare, it works in unison. You can get a Medicare supplement plan that can pay nearly all the deductibles, copays, and co-insurances with original Medicare. So that is the protection if you're on original Medicare. These plans, when you first turn 65 or go on to Medicare B for the first time, are guaranteed issue, which means that you cannot be turned down regardless of health. So many people who want to get Medicare supplement, they'll make that decision to get it when it's guaranteed issue, because in the future, it might not be available if you have substantial health problems. Let's talk about how the plans are offered. Lots of insurance companies sell Medicare supplement plans, but they all have to conform to a standardization that was set forth by the government about 30 years ago. This is a chart here of Medicare supplement plans, also known as Medigap. Medicare supplement and Medigap are synonymous. As you can see, there's 10 plans, A, B, C, D, F, G, K, L. This is not to be confused with Medicare Part A or Medicare Part B. This is a whole new alphabet. So any company, doesn't matter which one, if they want to sell Medicare supplement insurance, it has to be sold in this fashion. The purpose of this was to make the shopping for the consumer easier. You basically can get a Medicare supplement book from Company A and Company B. You open it up and say you're looking at the Plan G. The benefits are going to be identical. It's to make the shopping easier for the consumer. What will vary is the price that the company's charging, the company reputation that you feel comfortable with, and some of the companies have add-on benefits, like they'll add like a discount dental plan or something like that. But as far as the medical benefits go, the A and B benefits, they have to be the same. Now, I purposely picked the Plan G because that is the most popular plan by far. It's the closest thing that a person can get to 100% coverage that there is. It used to be the Plan F because the Plan F paid 100% of all the deductibles, copays, and coinsurances. But the F is no longer available for people going on to Medicare after January 1st, 2020. So G's become the new F. Basically, if you have a Plan G in original Medicare, the most out of pocket you can pay is $203 for the Part B deductible. Okay, so consequently, because the G pays so much, it's going to be the most expensive of the plans. The prices of supplements range for a person turning 65 anywhere from $65 a month to $185 a month, and it'll be dependent on the plan that a person chooses. The more coverage you want, like the Plan G, that's going to be more expensive. Okay, so any new questions, Julie, about that? Doing good?
No, it looks like so far so good.
Okay. Okay. We are going to go back to our screen here. And one thing very important to keep in mind, with Medicare supplement insurance and the original Medicare, you can go to any doctor, any hospital, anywhere in the country. Your Medicare supplement follows you. Original Medicare is the primary payer. Medicare supplement insurance will be the secondary payer. Okay. Now, one thing that's important to remember about supplement insurance also is that it can only pay for charges that are approved by Medicare, A and B charges. Medicare supplements cannot pay for anything that's not a Medicare A or B charge. So what is one of the things not approved by Medicare A and B? The big one that stands out is prescription drugs. Prescription drugs are not covered by original Medicare. Only drugs received in a facility are going to be covered. So if you have medications where you need to go to Walgreens or Walmart or CVS, you're going to need what's called a Part D card, standalone Part D for the prescriptions. This is another insurance plan sold by private insurance companies for another monthly premium, although the premiums are not that expensive. Okay, but Medicare supplements are limited to what Medicare approves. Medicare does not approve a lot of things that people think it does, like dental and vision, hearing aids. Those things are not covered by original Medicare and then therefore can't be covered by a Medicare supplement. Okay. I think I've covered most everything we want about the supplement, so we're going to change gears and we're going to go to Medicare Advantage and how it's different than what we've been talking about. Okay, first of all, Medicare Advantage plans are offered by private insurance companies, but there's a huge difference, and this is the difference. Medicare Advantage plans, and these plans are sold by most of the same companies that sell Medicare supplement insurance, also sell Medicare Advantage plans. The difference is that the Advantage plan has a contract with the federal government. They have an agreement that the federal government will transfer all of its claim paying responsibility from themselves to the insurance company, and they subsidize the insurance companies. So if a person joins a plan, it doesn't matter which company it is, same thing happens. The federal government will take you off original Medicare. They will subsidize the insurance company, and you will get your Medicare benefits through the insurance company instead of original Medicare. This is all done behind the scenes. There's a fixed amount that goes in for every member that signs up for Medicare Advantage. The Advantage plans receive this money from Medicare. They pool it, and then they're given the responsibility of paying your Medicare A and B claims. They're getting federal money, so they are scrutinized very carefully by the federal government to make sure that they're paying out the A and B, the same A and B benefits that a person would get under original Medicare. They can't cut the benefits. They can pay them differently, but they can't take away any of the benefits. So this is an alternative to original Medicare. So let's take a look more at Medicare Advantage. Medicare Advantage, you're still part of the Medicare program. It's called Medicare Part C. These plans are contracted with Medicare. You are still part of the Medicare program, which means that you still have to pay the $148.50 for your Part B. You retain your Medicare rights and privileges, meaning that you have the opportunity to go back to original Medicare. Now, why would a person sign up for Medicare Advantage? One of the reasons. Had a little interference there. Sorry. Why would a person sign up for Medicare Advantage? Well, one of the main reasons.
Someone is not on mute. If you're not on mute, could you please mute your phone, please?
Thank you.
Thank you.
One of the reasons why people join Medicare Advantage is that you can receive benefits from Medicare Advantage that are not approved by Medicare. You can get benefits like dental, vision, gym membership, hearing aids, transportation to the doctor, over-the-counter benefits. Some of the plans will even pay part of your Part B premium for you as an incentive to join. So this is a very strong reason why people will join Medicare Advantage. Prescription drugs. If you join Medicare Advantage, most of the plans will provide Part D embedded right in the plan. Okay, so people will join Medicare Advantage for all the extra benefits, the convenience of having Part D in the same plan.
Excuse me, someone is continuing to talk without their phone on mute. I don't know, Julie, if you can. Oh dear.
Este es precioso, es delgadito, pero también en negro, tiene muchos colores. Y este es igual a este, que este se va a encantar.
I'm sorry, we're trying to get the controls back so that we can mute some of the, it looks like, it sounds like maybe somebody figured it out. Yeah. Julie had a little problem with the controls there. Okay.
Okay.
Thank you.
Okay, we're talking about the reasons why people join Medicare Advantage. It's for dental, vision, hearing aids, the thing I mentioned before. But the extra benefits are not the main reason why people join Medicare Advantage plans. The number one reason why people join is that the vast majority of plans do not charge a monthly premium. You're only responsible for still paying the $148.50 for Part B. And in fact, some of the plans will actually, like I said, give you a credit each month to lower that $148.50 premium. So as you can see, people join Advantage plans for different reasons. In fact, let's sum up why people join Medicare Advantage. People join Medicare Advantage for zero premium extra benefits and Medicare supplement for access and predictability. Access is very important. Why? Because with Medicare Advantage, unlike original Medicare and a supplement, you cannot just go to any doctor, any hospital that accepts Medicare. You have to use providers that are in the plan network. all Medicare Advantage plans have networks that you have to utilize. The basic networks come in two forms, HMO and PPO. If you've ever been on an HMO before or a PPO before, they work the same way. With a Medicare Advantage HMO, you have to pick a primary care physician, get a referral to see most specialists, and you're only covered out of network for emergencies and urgently needed care. A PPO, you have in-network benefits and out-of-network benefits. Most people on group insurance have PPOs. So you have contracted providers in network, and but you can go out of network. It's just that you'll pay more for your care if you go to a non-network provider. Okay, but both options are available. I'm going to skip private fee for service because we don't really have those types of plans here locally. We are going to talk a lot about special needs plans. Before we get to that, I want to go back to one of the two things. Again, why choose Medicare? Why choose Medicare Advantage? What most people are actually choosing right now, this year, 3 out of 4 people going on to Medicare are choosing Medicare Advantage, in case you were curious. The reasons why people go with a Medicare supplement: access, any doctor, any hospital, predictability. You have a monthly premium for your supplement, but you can get a plan that has very little out of pocket when you get sick. So if access and predictability is what you're looking for, the supplement provides that. Advantage, again, 0 premium and extra benefits. There's no right or wrong decision. Everybody's different, and it's just a matter of where you feel more comfortable getting your Medicare benefits. Okay. We'll take a little pause here, see if there's any questions. We're doing good?
And Joe, the
Yeah.
Medicare Advantage plans also include the Part D coverage for
The Part D.
prescription
Yeah.
drugs, right? Yeah. So
Yes,
it's like an all-in-one type of plan, but you have to stay within a network of doctors.
right. If you're going to get benefits from your plan, you have to utilize the network. With an HMO, you have to get a referral also, and you can only get coverage out of network for emergencies and urgent care. PPO will give you more freedom. Okay. I want to talk a little bit about prescription drug coverage. As Sharon just mentioned, you can get prescription drug coverage through Medicare Advantage, or you can get it as a standalone if you stay on original Medicare. In both cases, it's required that a person have Part D coverage when they go on to Medicare. Now, as I mentioned before, if you work for an employer and you're delaying your Medicare enrollment, you can delay the Part D also if you have prescription drug coverage with the employee, if you have qualified coverage. If you don't have that coverage and you pick up the Part D later on in the future, you could pay a penalty for that. So there's a strong incentive for people to have Part D coverage right away, either through an employer or through standalone or through Medicare Advantage. Any one of the 3 ways counts. A little bit about prescription drug plans. Prescription drug coverage is not standardized. My thing went dead. Oh, I can get to click on the screen now. There we go. Okay. The plans for Part D are not standardized. Each company has its own price, its own copays, list of medications that are covered, which is the formulary, and it will vary between companies. And some companies will have some limitations on certain medications. Okay. The biggest one being step therapy. Some companies make you try one drug before approving another. That can be waived with the doctor's request, but this is stuff that a person wants to know before they join a plan. Before you join a plan, you want to know if your medication's covered, you want to know how much you're going to pay for it, and you want to know if there's any limitations on it. This can all be done with the drug search engine that's offered at Medicare's website, medicare.gov. We utilize the website for our clients. Basically, we can plug in the information, and every single plan that's available will be compared as to what the out-of-pocket would be for that medication. So at the end, you can figure out which plan is going to save the client the most money. We do this for our clients as a courtesy. It's open to anybody. You can go to medicare.gov and use that to make a decision on the Part D. This is utilized whether it's a standalone or if you're getting your Part D through Medicare Advantage. And that's part of the decision. Part of the decision, there's many plans out there. There's for Medicare Advantage, there's 15 companies selling 56 plans right now. That's going up next year. The way you discriminate as to what plan would work best, it comes down to really basically 3-4 things. The doctors that a person needs to see, the medications that a person takes, whether they prefer HMO or PPO, and what kind of extra benefits they're looking for. Is dental important? So utilizing that criteria, you can narrow down the choices to what's going to be the best one for the client. It's not so much you guess the right plan, you just, by process of elimination, eliminate the plans that aren't going to work, and you choose the last plan standing. With Medicare Supplement, it's a little bit easier because the plans are standardized, there's no network, everybody sells the same plan. So Medicare Supplement, it's pretty easy. Medicare Advantage requires a little bit of more work to make sure that the person's getting the right plan. I'm actually going to leave this for the section coming up with the trust,
Okay,
because there's a chart that agent has that's similar to this. Okay, we'll talk about it. We'll talk about the model, what companies have to follow, the coverage gap. We're going to address that in just a moment. Okay. Want to cover enrollment periods? This is when enrollment periods control Medicare Advantage and prescription drug plans. Medicare supplements are not subject to this. For Medicare Advantage, you can join a Medicare Advantage plan or prescription drug plan between October 15th and December 7th. During January 1st and March 31st, if you are on a Medicare Advantage plan, you can change your plan one time. Now, if a person's is turning 65, or they're going on to Medicare B for the first time, they can actually enroll right away. They don't have to wait for the enrollment period. The enrollment period is for everybody else that's already on a plan. Okay. So for a good part of the year, a person is what we call lock-in, when you cannot change your plan unless you have a qualifying event, like you qualify for Medicaid, or you can join a 5-star plan. There's a couple of companies that are allowed to do year-round enrollment. But basically, most people have to follow these enrollment periods, kind of like group insurance. You're on a group plan. Once a year, there's an enrollment period. You decide whether you're going to keep your plan or you're going to change it. If you do nothing, you just stay on the same plan. And that's the same way they've worked out Medicare Advantage plans. Okay. And this is going to be my last slide. And basically, what this is here, somebody mentioned before about Medicaid. There is extra help for people that are of modest income and savings. If you are below a certain amount of savings and income, you can qualify for extra help, low-income subsidy, which is a federal program that helps pay for the cost of medications. Or you may qualify for Medicaid, which also pays for the cost, lowers the cost of medications. It also can eliminate the Part B premium and also can lower your out-of-pocket when you get sick. Okay. When a person comes into our office, we will screen to see if they're eligible for these benefits. If their income and savings below a certain amount. Now, the sad truth is that if a person's $1 over the qualifications, they don't get any help at all. So if the qualification is 1,000, if person's has 1,001 in income coming in per month, they don't qualify. But the person with 1,000 can qualify for everything. So this has presented a big problem for many people. And however, this is where agent has come in and actually made it possible for people who are not eligible for Medicare based on the guidelines Medicaid to become eligible for Medicaid. Sharon has helped a large number of my clients do this. And right now she's in the process of helping my mom, who is in a assisted living facility. And we've got to the point where she needs to get extra help. And the help that's going to be provided is going to be a tremendous help financially, mostly to me, because without it, I would be paying more towards my mom's cost of care. One last thing I want to mention too, if a person qualifies for Medicaid, we'll circle back to this. If a person qualifies for Medicaid, they can actually get what's called a special needs plan, which is a Medicare Advantage plan that has enhanced benefits. A person on such a plan can pay very little out of pocket, or actually pay zero out of pocket for their Medicare expenses. They may qualify for a very robust dental plan, sometimes a plan that can pay unlimited benefits. A person qualify for over-the-counter benefits. The benefits are tremendous and can make a huge difference in a person's life that's living on a fixed income. But first, I can let Sharon take over and talk about where agent comes in.
Okay, great. Is there any chat that needs to be addressed?
So
Any questions?
you mentioned that some Medicare Advantage plans reimburse some of the
Yes.
Part B premium. Is this related to income or not?
Great question. No, there are Medicare plans that we call core plans, and they're basically available for everybody. Warren Buffett and Bill Gates can qualify for the plans. And if they choose to enroll in them, they will get a discount on their Part B premium. So it's available to everybody, okay, regardless of income. If you join a plan that has what we call a Part B give back. Great question.
Good question. Great. Thank you, Joe. That was a great overview of Medicare. So Joe will have a client that he's working with who is going to be spending, he's given Joe the prescription drugs, and Joe's saying, oh, this person is going to be spending $300 a month of prescription drugs. And they need help because they're living on a fixed income. So
Julie,
Joe will
go to the
sometimes
next
say,
page. Wanna
go
show-
talk to Sharon. She can potentially help these people to qualify for the extra help program, which will reduce their drug costs.
With the Part D plan alone, a person can have tremendous out-of-pocket for their medications. There's three phases. There's the initial coverage where a member will pay copays, maybe pay a small deductible, but the copays can add up to a lot. And if the retail price of the medications exceeds $41.30, they have a severe reduction in coverage where they can pay up to 25% of the cost of the meds. Now, if this is a $1,000 med, that's a lot of money. $500 med, 25%, that's a lot of money. So with Part D and no other help, a person's personal out-of-pocket can reach as high as $65.50 before they get catastrophic coverage protection. The coverage gap has also been known as the donut hole. But with Part D coverage, a person can spend $5,000–6,000 out of their pocket for their medications.
Right, right.
And this is where Agent has helped my clients eliminate, not eliminate, but substantially reduce these costs.
Yes,
In some cases, eliminate.
right.
You know,
Now, how do we do that? Go back to the special needs trust slide. So we have a pooled special needs trust. It's highlighted in yellow there for you. It's governed by federal code, Social Security, and Medicaid codes. So the basic idea is that any monies that go into the trust do not count for Medicaid purposes. So if someone is over the income limit to qualify for one of the Medicaid programs, or over the asset limit, they can use a pooled trust to qualify. And there's no waiting period, look back period, etc. The day they put the money into the trust is the day that we can then, or that they can then apply for Medicaid. Okay, there are a couple rules around. You have to be disabled. So if you're 65 or under 65, that means you're on Social Security disability benefits, SSI or SSDI. If you're 65 or older, you have to meet the definition of being disabled, which is basically you're unable to work in substantial gainful employment for at least 12 months. So the people that, you know, have a lot of prescription drugs or a lot of copays because they're going to the doctors and the hospitals a lot, usually meet these criteria. But I have to screen those people to make sure, you know, they're not still working, you know, they just want some extra help. So that is one of the qualifications. And there are about 10 pool trust companies in the state of Florida. We're in the Central Florida area, but we cover the whole state. So Julie, you can go ahead and flip the slide. I do a lot of training on this. This is a 5-minute quick overview for you. So the big program that we try to help Medicare beneficiaries qualify for is called QMB, qualified Medicare beneficiary. This is for people that already have Medicare. And now Medicaid kind of comes in and picks up as a supplement. That's the way I think of it. In order to qualify for that, if you are an individual, unmarried, your gross monthly income from all sources has to be less than $1,074. That includes Social Security, pensions, IRA distributions, etc. Your countable assets have to be less than $7,970. So Joe's working with someone that is spending $300 a month in meds, and they're living on a Social Security benefit of $1,600, $1,900. They're spending a lot in healthcare. Okay. We try to help them reduce their healthcare costs so they can afford their food, they can afford, the healthcare that they need. When they can qualify for QMB, they get the extra help, the low-income subsidy Joe was just talking about. Here's a slide on exactly what that means. Their meds will go down to $0 to $10 generally. Okay. You can have traditional Medicare and a Part D plan, but now you get the extra help, the cost is going to go down, or you get special needs plan, cost goes down. Part D annual deductible is covered. The Part D premium is paid for you up to about $35 or so. And there's no donut hole. That slide that Joe just went over, that coverage gap, you stay out of that gap. So you're pretty much in the catastrophic stage all the time. Drugs are $0 to $10. It also pays for your Medicare premium. That will go back in your Social Security check. So when you get qualified, that $149 that's being deducted from Social Security check is no longer deducted. It goes up. Medicare deductible is paid by Medicaid. What's the deductible this year?
$445.
$445. Okay. And the Medicare coinsurance. So that's your percentage or your copay when you go to the doctors and the hospital. So on the on the Advantage plans, someone has, for instance, a Humana plan. They have a card that says, I have a Medicare Advantage plan by this company, Humana, United, whoever it is. On the bottom of that card, it has what your copays are. If you go to a specialist, it can be $45, $65. You go to the ER room, etc. When you get qualified for this plan, let's say, then you switch your plan to the special needs plan. So I personally know that United has a special needs plan, Humana has one, and there's lots of other companies out there that do.
Mhm.
You get a new card in the mail, and at the bottom of that card, the copay say $0. So when you go to a specialist, as long as you stay within that network, just like on your regular Advantage plan, you don't pay anything. As long as Medicare covers the cost, you don't pay anything.
One thing I didn't emphasize with regular Medicare Advantage plans is that you actually have copays when you get sick.
Yes.
If you go into the hospital for a week, depending on the plan you're with, you could owe $500 or $1,000,
Right.
maybe more. Labs, testing, X-rays, cancer treatment, all those things have cost sharing. And the cost sharing on Medicare Advantage plans, depending on the plan you have, it could be low, like maybe just about $2,000, but it could be as much as $6,000.
Right.
So kind of like group insurance, an out-of-pocket group insurance. So what happens is the special needs plan takes whatever that would have been and turns it into $0.
Yep, that's right. And we open a lot of trusts just to help cover Medicare copays. Slide change. So we already talked about the coverage gap. Okay, go ahead. So here's an example. We had Andy who came to us. He was diabetic. He was in the donut hole. Andy also needed back surgery, but Andy could not afford the back surgery. He has monthly incomes of $1,900 a month. His assets are $6,000. So he's below the asset requirement to meet QMB. Okay. But he's above the income requirement. So how is Andy going to qualify to get the help he needs? He opens a full trust. and every month transfers $900 into the trust. This reduces Andy's countable income. So now Medicaid says his income is only $1,000 a month. He qualifies for QMB. What does he get? His insulin goes down to $3.70 from $300. He has the back surgery and he pays nothing. Those copays are zero. The Social Security check goes up by $149 because Medicaid is paying the Part D premium. Now, our trustee fee for doing a trust like this is $105 a month. So let's think about it. Andy's Social Security checks going up by $149. We charge $105. He's actually making $44 a month in extra cash. Plus, he's getting all these benefits. So it truly is a win-win for Andy. I have clients that sit in this conference room or prospects. I had a prospect that said, I don't know what's wrong with me. I keep going to the specialist and I can't afford to go to the specialist anymore. They've told me, can't come back because I can't pay. So we helped Donna get a pool trust. Her copays went to zero. She was able to go back to the doctors and they finally figured out what was wrong with her. She had an autoimmune disease, right? Donna now takes medication for her autoimmune disease because she's, she reduced her countable income and, meds are very low expense and she doesn't pay anything to go to the specialist. So she gets the care that she needs. So it really is all about helping people.
A huge problem that I've seen is there's many people that skip medications that are very expensive.
That's right.
And there's people that were not taking meds because they couldn't afford them. They went onto the full trust and now they're taking the medications
That's
that
right.
they just couldn't afford them before.
That's
Now
right.
they can. This is life changing for people.
I met someone about 6 months ago that, was referred to me. Oh, this lady really needs help. I go to her house and she says, oh, I don't really need that much help. I just don't take the medications that my doctor prescribes because I can't afford them.
Yeah.
So 3 months later, she was back saying, yes, I want to open a pool trust. I've decided.
Yeah.
So, there's just so many situations out there. In fact, I just read the statistics, 445,000 people in the state of Florida cut their pills in half
Oh.
because they can't afford them.
Oh,
So,
that's a shame.
okay, let's go on. Let's see what else do we have here. This is just a great visual to understand how the trust works. Your Andy's $1,900 goes into his checking account every month. $900 goes into his trust. We use that money and pay his bills. We take our $105 fee. We can pay Andy's rent, mortgage, utilities, cell phone bill, pay for whatever he needs us to pay for, as long as we have money in the trust. It's generally as simple as that. So next slide. Yeah. Okay. So that concludes the actual slides. And again, we at AGID have a lot of some videos on our website to talk more about that particular thing. Joe knows a tremendous amount about it because we have worked together for a long time, helping people to really be able to afford the healthcare they need. So we'll take some more questions now. Okay.
So for QMB, the limit, the $1,074, is that for the adjusted gross income?
It's
or
not
how does that work?
adjusted gross income, it's total gross income. So it's before any deductions. If your Social Security check is, $1,600, your gross is $1,600 plus, $149, $1,800 or $1,750. So it's gross. If it's pension, it's before deductions for taxes, anything. Right, and a lot of people ask me on the asset side, a house does not count. Your homestead, as long as it's less than, I think it's about 600,000 now, something like that. What other questions do we have on Medicare, Medicaid? Did you want to say something?
No, one thing I mentioned too, it's a common, what way it works with many of my clients is that they already have a plan like a Humana or United Healthcare. And they have a regular Medicare Advantage plan. They qualify, they get the full trust. And then what I'll basically do is move them from the Humana standard plan or the United Healthcare standard plan to the special needs plan, which means that they don't have to change doctors or do anything. They just have a different card now. And like Sharon said, instead of having doctor copays, they have no copays. So people often don't have to change their lives very much. They don't have to change their insurance company. They don't have to look for new doctors or anything.
Right. And Joe was just telling me a statistic earlier that, you know, if you as professionals are working with people and they might say, well, I'm on Medicaid, and maybe they are, but they haven't switched their plan, they're not going to get the benefits. So, you know, we try to really work with our clients to make sure they understand when they get benefits, then they need to go back and switch their plan.
A majority of Medicare beneficiaries that qualify for Medicaid don't even know about the special needs plans. And they're plans that can be tremendous for them, between the extra benefits like the dental, the vision, the hearing aids, everything else. The food, they actually have food cards like $25, $50 a month. Over-the-counter items, $100, $125 a month. That can make a huge difference in their lives, and many people don't know about this.
Right.
So we have about 2 minutes left, well, about a minute left, but we have a couple of questions. So if a person has Medicare and Medicaid, would they still need the Medicare Part D?
Yes, the Part D is the vehicle to getting prescription drugs. That's the only way to get them when you're on Medicare. There's no other way you can get it. So you have to have the Part D, but you don't have to pay for the Part D if you qualify for Medicaid.
Right. And again, if you're doing traditional Medicaid care, you can, instead of buying that supplement, you can use the Medicaid.
Yes, you can.
But you still have to have a Part D in that case. It's just that Medicaid will pay that $35. Under the Advantage plan side, the Part D is already included in that Advantage plan. So that's when you're going to switch to a special needs Advantage plan.
Another thing too is that the Advantage plans, the network of doctors provided is often bigger than your doctors that are going to take just basic
Traditional
regular Medicaid. Right.
Medicaid.
A lot of times you can expand your access to healthcare.
That's
I saw a question there. Is there an income or asset limit above which you cannot create a pool trust? And
That's a good question. And the answer to that is no. There is no maximum limit, you know. Now let's be, you know, reasonable here. You don't really want to put typically $1 million into a pool trust to get, you know, these, and the pool trust can also be, this is medical Medicaid we're talking about here for the pool trust. It works for long-term care and other types of Medicaid also. But today we're just talking about Medicare with Medicaid. But that's a good question.
Another question we got with regards to Medicaid, what else besides the homestead is not counted?
Yeah.
well, they don't count your home that you're living in or your car.
One vehicle.
There's one vehicle.
Yeah.
Mhm. Pretty much everything else that you can get your hands on counts. So, you know,
IRAs.
so the IRAs are hybrid assets. They can either count as income if you're taking the monthly income distributions, or they count as an asset. The thing that we run into sometimes is cash value and life insurance. You know, there are some very small amounts that you can sometimes have.
I think it's 1,500 is tops.
But if you have anything more than about 1,500 or so, the cash value in the life insurance is going to count towards that asset limit. So there's things that can be done. We at Agent are not attorneys. If someone's got, you know, money like more than 10,000 or so, you know, that they're putting into the trust, they're going to consult with an elder law attorney to make sure the trust is the right thing to do. But we can talk more offline. I know my contact information isn't up there, but you all have, Joe has my info and Julie, of course,
And
is here at Agent.
And don't hesitate to use me as a resource. I love helping. If you send me an email, text me, call me, I'm happy to answer questions. I'll get back with people right away, and I just like the opportunity to help people, help others.
And we'll make sure that Joe's information goes out when I do the follow-up email today. Looks like we have another question, so we're at time, but if you guys have more questions, you're welcome to send them through. The question is, if someone wanted the Special Needs Advantage Plan, who do they contact? Our consumers get so many letters, and it's hard to tell which letters are legitimate and which letters are scams.
You know, it's a very good question. A lot of information that is sent to people, it looks very official, like it came from the government, but actually it's what we call marketing material. Marketing material is designed to steer you toward a specific plan. Now, there's nothing wrong with marketing material if you know what it is. That's the purpose of it. It can look official, but you want to speak to, of course, I'm a little bit biased here. You want to speak to a knowledgeable independent insurance agent that specializes in this type of insurance, someone that's been in the business a very long time. If you want to if you don't want to speak to an insurance agent, there are consumer counseling. There's Shine. There's Shine. If you don't want to speak to an insurance agent, Shine is offered. There's consumer counseling that is available through the state.
Does anybody else have any other questions before we wrap it up?
Thank you very much for attending. It's been a pleasure.
And like I said, we'll send out some more information. We do have a little cheat sheet follow-up for you guys all to have. We'll make sure you guys have Joe's information and Sharon's information. If you ever have a question or need a resource, I'm sure either one of them are happy to do that for you guys.
Right, and thank you so much again on behalf of Agent. And our next webinar is going to be on October 7th. We're going to talk about the different types of special needs trust at that time. So please stay tuned for more information, and thank you for joining.
Thank you guys. Have a good day.